Well, finally back to some of my usual videos here. So this time I'm going to read you a few excerpts from the Wall Street Journal, and in particular the interview of White House Chief of Staff, essentially, Emanuel. And Rahm Emanuel had the following to say to the Wall Street Journal. And I need to add here, of course, that President Obama has already repudiated this interpretation by his own Chief of Staff, no less. But he did it in a public way, while Emanuel was actually speaking to the Wall Street crowd, which, in some ways should probably be taken more seriously by us than all the claptrap on television these days. So here it goes. The goal is to have a means and mechanism to keep private insurers honest, he said in an interview. This is Rahm Emanuel. The goal is non-negotiable, and the path, however, is negotiable. So then President Obama has, of course, campaigned vigorously for a full public option, but he has also said that he won't draw a line in the sand over this point. On Tuesday, the White House issued a statement reiterating his support for a public plan. This is a Wall Street Journal article, and if they will allow me to post a link to it, these are usually you can't. Wall Street Journal is a publication you have to subscribe to, and the links are not free, and I don't have a subscription to that journal, so if the link doesn't work 2 days from now, please don't blame me, because I can't pay for that publication. In any case, it goes on to say, I'm pleased by the progress that we're making on healthcare reform, and I still believe, as I've said before, that one of the best ways to bring down costs, provide more choices, and assure quality care is a public option that will force the insurance companies to compete and keep them honest, the president said in a statement. I look forward to the final product that achieves these very important goals. The Wall Street Journal goes on to say that the jockeying over the public plan came as the Senate Finance Committee pushed for a bipartisan deal. To help pay for the package, the committee planned to announce an agreement Wednesday with hospitals and the White House for a $155 billion plan over a decade, that's 10 years, in reductions to Medicare and charity care payments for hospitals. Reductions. Notice this, reductions. According to a person familiar with the agreement, that will help pay for the legislation expected to cost at least $1 trillion over the next 10 years. So basically what you're doing here is you're going to take away from one program to pay for the next. That's just for starters. The Wall Street Journal, of course, has no problem with that. One of the they say one of the most contentious issues is whether to create a public health insurance plan to compete with private companies. Now, remember, this is the Wall Street Journal talking. To them, this plan is contentious. Of course it's contentious, because it's going to cut in to some profits of some of the big bankers and insurance companies in K Street and on Wall Street. That's why it's contentious. For most of the American people, this plan is not contentious. We want it, and that's why we voted in a particular way to make this happen. So to say that a public health insurance option is contentious is a huge lie coming from the Wall Street Journal. Yes, well, to them it's true, of course, because to them it's contentious. To us, it's not. Mr. Emanuel said one of the ways to meet Mr. Obama's goals is a mechanism under which a public plan is introduced only if the marketplace fails to provide sufficient competition on its own. Now, in case anyone hasn't noticed, the market mechanism has completely failed to provide a mechanism on its own, because a lot of people are uninsured and underinsured. So now the newest plan on the table is that we are supposed to wait for 7 or 8 more years until the private insurers can come up with some competition amongst themselves. You see, and that's the trigger, it's called the trigger option in these plans being discussed now, that a public option would only kick in, maybe 5 or 10 years from now, if these companies actually can't be honest with us, and if they somehow fail to get some competition generated amongst themselves. The audacity of this argument should be on every television channel in the nation 24/7, just like this Michael Jackson memorial service, because it's our memorial service from this point on if these kinds of bills get passed. So hospitals and insurers now hope to gain some degree of control, and in principle a healthcare overhaul could benefit both groups by raising the number of Americans who buy and have health insurance. That's if they're forced to buy it in the first place. And notice the groups, 2 groups, hospitals and insurers. There's absolutely no mention of patients and those people who actually seek care in those hospitals. Hello? So I'll try to post a link to that article, but I know they're going to take it down. So essentially, Emanuel was pushing the trigger mechanism, and the White House essentially, sent a little message over for us regular folks, the rabble-rousers, to all calm us down. Oh, don't worry, the public option is still on the table. Well, that's the public option being discussed in the Senate now, and that's the only option on the table at this point. Basically, with minor variations on single payer is completely off the table, as I said. And if we're going to move towards any kind of equitable healthcare system, then this is a sham, and nobody should be in support of this. Either we're going to do some fundamental reforms in this country in terms of equitable health care, and yes, some people are going to take some hits, just like the rest of us, just like the American people. The companies, the insurers, the hospitals, the doctors, everybody is going to have to scale down a little bit. Just, when we say the American people, that's exactly what we mean. So if you want to be patriotic about this, well then okay, let's chip in, insurers and hospitals and doctors and nurses and patients and everyone. And unless we can all come together on this with some amicability, there's going to be a fight. And the fight is not going to be carried out with pitchforks. It's going to be the kind of scenario where people are going to be literally dying because they cannot have care anymore. Their employers, their small employers, cannot afford the premiums for their employees. A lot of businesses are shutting down. And, you know, what actually is the Senate waiting for? What do they want? I guess they just all want us to be like, you know, 20th century slaves and just work for basically suppressed wages without any benefits at all. That's exactly what they want. So, I don't know. I don't know what it's going to take, but that's probably what it's going to come to. Good night.